Olivina chuan reitok kare wang nuin makkati mai kalau shil don chawa nangni pon makin ti ve ngei karinga chuwangin pe hel lovin kasoi chhawngal bor mai nga medical line na de po latingai mi lo tan chuan cancer nat na hiti dam theilo nat na ti kan shat larania kalau shat ve thin dan taka phei chuan cancer nat na dam doi hi an la mu chuak lova hewang hian cancer nat na hi chu HIV nat na aipun ala zo ke ti kha kalau shat ve thin dan chu nia chuwangin cancer nat na hi chu achi in kalau chi em thina amai ro chu hei kolkata bikhwal abikin damlo ho thlen khom na tur kan siam ta ka chuan damlo tu po kolkata khoi hospital po pandu kan khwal bu ka lo thleng ti reng chu a thlon veka damdoi ina shwai na kan kalpui chhota ka chuan cancer na nei te hi kan mi khwal tam ber ten ya heta kolkata ruby general hospital a hian cancer na nei te hi an local khom tlang puya cancer na bi doctor specialist kan ti mai oncology doctor te hi ruby general hospital a hian thiam le bon tak an nei wang hian an hospital hi cancer bi ka hian an ming than phalia tin ruby general hospital a hian sarkar atanga athona in entirna le treatment lak na kan ti mai golden card le Mizoram healthcare man vek theina mun Mizoram sarkar te ne in thunzom hospital ani buka wang hian Mizoram puite hian kan bo na sa hlea chuwang chuan makkati thin mai chu ama zong cancer chu ti dam theilo natna ani tia kalo sha thin kha he hospital a hi chuan an zeidam mak thin si lai hi cancer na tam tak hi chu ti dam theinatna ani nge ye ti hi ka shat pha mi pui tam tak la shelo tan po kan shat hi tha ka tia cancer na ve mek ten cancer na nei dan zerin chemotherapy le radiotherapy te an nei saka cancer na dam thei to lo tur anga mi tam takina kan ngei thin kha he hospital a nge hian an lo ti dam sak thin ani ti hi mit nge mu thei tam tak mizo zinga po anam to wangin hospital changthung le doctor thiam rual te khom na huna na hi chuan theilo anga kan ngei tam tak hi a thei ani ti hi chiang vyawani ka tia chuwangin ruby general hospital kolkata nge hian cancer mai po ni lo department sang akim thokhat em wang hian engnat na po nei te tan a thlonin en kolna healthcare siam tir to phot kha chuan he mun hi lo pan zong zel mai don ne o tin tun october thalai hola khan damdo in top china lo chuan zen lo bone marrow transplant na khol ro puizat me chuan damdo ina hian an lo hung thar boka bone marrow transplant hi shethiam lo kan lom takin hetiang lama kan mi zo mi thiam lal ro sange MSc nursing medical surgical nursing critical care clinical experience bone marrow transplant TMC Kolkata ina athu soi hi ngun davin ngai thla khona in nei ta ngalila
bone marrow transplant hi stem cell transplant ti punang soibok china bone marrow transplant a chuanin I Mizoram chuanin thlin kha ani mayang chu kan bone marrow te hi kan thisen kan blood cell siam tu te ani a an poimo em ma sedam lawin na indinan I thisen cancer kan ti ang leukemia te lymphoma te multiple myeloma te le na dang bone marrow che an nei chuanin thlin kha angai thin ta ni indinan dam lawin thisen cancer nei ta a stage lo sang to a bone marrow te an function to lawa cancer in di cheto a khatia ma te khan kha ka lo ngai thin ni chutiang condition chutiang procedure bone marrow transplant kan ti chuan ni mai ta chuan bone marrow a hianin transplant a hianin type ni kan nei ta chi ni pakhat chu allogenic ani dangle chu autologous bone marrow transplant ti ani autologous bone marrow transplant chuanin I damlo kha I wani khang takin athling chen khat kha ala chata ni athling chalai ten sarina khoi lo lai kha I kan la chwa phota anda cha chuanin chume nuwa damlo khan chemotherapy chemo adung ta chemo khai cancer cell te kha that ta mo ti kan da chat bone marrow kha dam lawa ho kan transfuse le chuan dam lo khan adung le ta chuan chu autologous bone marrow transplant ani chuan allogenic kan tia chuanin I donor ra omangai ta ni a petu thling petu kha tu te nge donor ra tang thei chu kan ti chuanin I damlo chung te a blood relate te ani lo ponin I midang misang dei poli se damlo blood ne cross matching kan ti a mil chuan mo I aman the ani chuanin bone marrow transplant I how tak ema I what te po siyang day ako mangaya and ko to staff te po inday ngaya chuan nurse te po I damlo kha serious chuan nurse pakhatin damlo pakhat kha kan en ko langai chinani chuanin I damlo hi damloi po pedoni na ml khat chau po ni se tiang ba pek thor thei lawa I PPE anti mask gloves gown engki I kanin thwa ma kan ka pek angaya kan pan nu khatian kan discard kan pai zet te kha ngai boka man ruwa hek ba ka I human resource kha kan ne chata ngai bok ta ni chuwan chuanin how taka ataw ma I odologa si atom de zo ka allogenic phei chu atawa noi som panga noi som thum te noi som man te kha ka chu dang lo condition zel khan aret kha chu ai a transplant man kha chu ang lo ta ni atawin awai kha a mai ro chu I cancer te hi thisen cancer te hi I sha chwama ani chuanin I dam le the fekania mi dam tak bone marrow transplant ti adam chwa mi pa ngai sel chapa ngai angaron nu pa ngai angaron nu ron ne hi an tam lu tu kani chuwa chuanin I enkol fata transplant ngai te an ni a bone marrow transplant ti fata thilakal tran chuanin I dam thatkin om le the bok ani chuwa chuanin I apoi mo ma bone marrow transplant hi Kolkata apo hianin bone marrow transplant the hospital hian la tam lo hi a Ruby General Hospital hianin bone marrow transplant unit hi an hong thara kan sha cheu angin Ruby General Hospital a hianin healthcare te ati thaya cashless te pon ati thaya chu a che ma azong healthcare recover thailo ma se enge mo to alo cover thai chuanin damlo te tan atangkai nun ani
nute cancer kani a Mizoram atanga Kolkata Ruby Hospital refer kani a chaw takin hospital kan thleng tha a doctor te le thoktu ten dua tak le uluk takin min lo enkola min enkol dana po an fim khur le mai tuna chuan pathian le doctor te zara cancer po kalodam le ta a Ruby Hospital Kolkata bul ka hian ma pui ke so sa kan thlenga anwamin a fel fain a thlen man te atomin ai man po an tiklom le mai in lo pan ve cheu donya Ruby Hospital Kolkata vul reng ro se
Ruby General Hospital Kolkata vul reng ro se
Ruby General Hospital Kolkata vul zero se
Hei tuna hian Ruby General Hospital tena an buat sei bone marrow transplant chu avoi khatnan Ruby Hospital a voin hian an launcha hei tuna hian press conference tena yin nipui te kan zimur mura helai mona hian kan tam le a voin hi an hun pe mo an ni pe mo ni a bone marrow transplant hi Kolkata hian hospital tam tak zinga hian ala manglawa tun hi hospital kem te zinga nei chhun turan ni a chuwangin helai hi apui emina he press meet te pon tam hlea zo tam takan zo ta kaini phe zo kropo kan nei manglawa chu tiang khob chuan helai hmuna hian an lu na ni Ruby Hospital an put le an pi berte bula kan om ne ka tuna hian Ruby Hospital assistant medical superintendent name
Dr. English
Doctor bulahan kan kauma so tak zo katuma tunahan kan zo don yam okay doctor, can you tell me about bone marrow transplant briefly so that Mizo people in the from village also they can understand?
Yeah.
Okay.
So bone marrow transplant is a procedure, it's a treatment procedure which is being done for the people who are diagnosed with some kind of leukemia. So this is an advanced treatment which is available at Ruby General Hospital and Cancer Center.
Yeah.
And we have got a very dedicated BMT ward with isolation facility. And the biggest advantage we have the most advanced blood bank support system which is helping us to do the BMT facility in our hospital.
Okay. Is there any high risk? Like,
No, it's not like very high risk procedure. It's considered in case of hemato-oncology, it is considered as a life-saving procedure. Or else people may die of blood cancer. But when we have the treatment, so
yeah. Okay.
Patients have to stay there for almost 1 month.
Duration?
Duration of the treatment is very long. And when the treatment is happening, we allow the patient relatives to also stay inside the hospital.
Okay, but within 1 month it will
Because
done.
we have to keep on giving the blood. The blood transfusion has to be done again and again. Okay, so at that time we really have to take care of the patient. His immunity is also low.
Okay.
So that is the reason the patient has to stay inside the hospital.
Okay. As a Mizo, as a Northeast state in Mizoram, is there any biggest advantage for us about Ruby Hospital?
Yeah, actually, we are empaneled with the government of Mizoram Health Services, and we provide cashless treatment for all the Mizoram patients. So they can just have to get one letter, and if they have the golden card, they can come to Ruby General Hospital for the treatment, which will be cashless. So 5 lakh is cashless, and if the treatment goes beyond 5 lakhs also, so the BSS of Mizoram are very, very helpful. I have seen lot of cancer patients, they have come but their limit has exceeded, but then again they have helped us in giving them allowed the extra amount also. This is also happening at times.
Omzatsu Hiltilai Muna Hian, Ruby Hospital Hian, Jeng Wai Nga Healthcare Cashless in Tahati Thea, Tin Jumi Baka Healthcare Mi Baka Khan, Golden Card, Awishman Card Kanti Poka Amantaya, Hilai Muna Hian, Tin Baka Katanga Joy Belvak Makangzi Tika Nevelawa, Ale Baka Mizo to Tanchuan, Hilai Munipanzi Takanina Chanchu, a home to Pohi Mizavina Kanjurim Takan Christian Naina. Akong kay tat may Mother Teresa na hon ni unahan ang muna kanom thaya kan loma ti khan zo tam takan nei chuan kan lo shilya zia don chawni.
Ruby Hospital is the best and cheapest hospital in Kolkata. Second, the Mizo people, which dominates 99% Christians, are thoroughly gentlemen and very nice in behavior. We welcome to our hospital.
The transplant is when a person has cancer of the blood and all. The bone marrow is replaced by somebody who has a compatible bone marrow. So once they get that person, they take the bone marrow from that person and injects it after removing the bone marrow of the diseased person. So that is bone marrow transplant. We are going to do transplant of bone marrow from October 2025. We have a special floor for bone marrow transplant. The reason is we have to be very careful that the patient doesn't get infected, because the diseased person bone marrow has to be destroyed. When the diseased person bone marrow is destroyed, there is a chance of infection. So after it's destroyed, they do the bone marrow transplant. The risk and side effects can be many. The main risk is the bone marrow transplant does not take up, so it doesn't work. So again, you have to get another person to give the bone marrow to do the transplant. And side effects are patients get very, very sick during the bone marrow transplant. Success rate depends on the institution, thing, but we have some of the best doctors in Kolkata who are doing the bone marrow transplant, and we are very interested in giving bone marrow transplant in young children, and we are getting it from Northeast. Ruby Cancer Center gets a lot of patients from the Northeast, and we want to, for the 30 years We are serving the Northeast very, very well, and we want to continue serving the Northeast. And one thing we do to serve them well is we have nurses who are from the Northeast who work at Ruby. So translation is not a problem. Achha. Who's in the care team of there? We have a lot of nurses, technicians, and laboratory place. And one thing about bone marrow transplant, you need a good blood bank. Ruby has one of the best blood banks in Kolkata.
By the way, this duration of this?
Yeah, what is the timeline duration? It depends on the patient. Some patients have to stay 1 week, some patients have to take three weeks. It all depends on how the patient is doing. Okay. But we are very interested to take care of the patients from the Northeast to do bone marrow transplant. And I think we have done it already, and we have a good success rate. Is the denied transfer, what condition? Is the water provided BRCT? That the doctor will talk in detail about what are the things after bone marrow transplant. What is special about Ruby Hospital other than different private hospitals in Calcutta? Ruby Hospital is the only doctor hospital in Kolkata. Other private hospitals are publicly listed, means they are on the stock market. We are not. I'm born in Kolkata, brought up in Kolkata. At age 25, I went to America. I'm doing practice in America. I come every 3 months, staying 3 weeks to Kolkata, talk to Ruby Hospital every day, and have a Zoom meeting every week also. So we are completely different. We are a doctor hospital, and we are not so much into profit because I don't have to show a profit. We want to give good care to Indian people. We have to, that is the main thing. We have to give good care, proper affordable care and respectful care to the patients. And as you know, most important, Ruby is the top 50 best hospitals in India. Newsweek magazine chooses the best hospitals. Ruby was the top 50 best hospitals in 2021, 2022, 2023, 2024, 2025. So it is we are very, very happy to have it done. Okay? What's your name? First name? Mapuri. Okay.
Last time we already done
Okay.
Yeah. Hospital,
And you did it last time? Okay.
Yeah, I did.
Mapuri. So let's see how many patients. Okay, Mapuri, thank you so much.
Thank you, sir.
Thank you.
Today's event is going to be a really special one because, like many other milestones we have achieved before, Ruby General Hospital is going to create another milestone in its journey of providing seamless, effective treatment to various strata of the society.
Okay, thank you. So this is, the crux of the problem is over here. If you have any cancer which is between 2.9 and 4.3, the analog of PET-CT, which is all over the world, most common, won't pick it up from 2.9 to 4.
So we are very, very proud of the care. আর আমাদের মোটামুটি সবচেয়ে ভালো ডাক্তার আছে। We have the best machines, a digital PET-CT, তারপর দুটো আমাদের linear accelerator যে আছে, একটা Varium 3.0 আর একটা হচ্ছে Clinac 9, আর আমাদের everything is geared to give the best treatment. আর এই digital PET-CT নিয়ে আমাদের খুব ভালো লাগছে যে আমরা will be able to help many patients get better treatment and get faster recovery also from the cancer.